talk about how lubricants might be able to be introduced as part of foreplay. If you would like to support the Everything Cancer podcast, there are links in the show notes to our Patreon page and our website. Welcome to the Everything Cancer podcast, the empowering extra-large suitcase of the cancer journey. I'm your host, Jill, longtime oncology certified nurse and cancer support group facilitator. This show is designed for survivors and those who love them, and to offer providers insight and fresh perspectives. The information shared on this podcast is not intended to be used for medical advice. For any healthcare concerns you have, please consult with your healthcare team. The staff at Everything Cancer Podcast will not be answering individual healthcare concern questions. Tonight, I am flying solo, and I'm going to be talking about lubricants. Lubricants are super important when it comes to intimacy. They have so many purposes and have so many benefits. They can be used as part of foreplay. They can be used to increase sexual pleasure. They can make sex and intimacy and foreplay less intimidating. They can relieve vaginal dryness related to cancer treatment or menopause. They can alleviate pain during penetration or foreplay or touching. They can decrease performance anxiety. They can prevent condom breakage, which will increase protection against unintended pregnancy, sexually transmitted infections, and also against exposing your partner to your anti-cancer agents that you may be treated with at this time. Also help with penetration if someone is dealing with erectile dysfunction and has somewhat less firmness. There are so many benefits to involving good lubricants in your intimacy and making it part of your foreplay and part of your sexual script. So go ahead and have fun with your lubricants. Make it part of your intimacy and your warmth with each other. So there are some ingredients you want to avoid in lubricants to prevent irritation. I may or may not pronounce these ingredients appropriately. Forgive me if I don't. And I will have these ingredients listed in the show notes. Chlorhexidine gluconate, polyquaternium, 7, 10, or 15. Definitely fragrances, as they're made with synthetic chemicals and can lead to irritation. Glycerin, as they may lead to yeast infections. Propylene glycol. Parabens. Spermicides, such as noxinol 9. Anything that is meant to cause a sensation, such as cooling or tingling in your lubricant. Often that is menthol or capsaicin, and those can be very irritating to a person with sensitive skin. Flavors are something to avoid. They disrupt the vaginal balance. They can cause irritation, and they can lead to yeast infections. Lidocaine or anything numbing in lubricants can mask pain, and that's not a good idea when you're dealing with more sensitive tissue or tissue that is dry or is thinning related to treatment, radiation, because that you can mask pain, which can lead to unknown injury or trauma until after the numbing wears off. So you want to avoid masking that pain. Also avoid lubricants that are made from mineral, petroleum, or baby oil. There's many reasons for that. They will disrupt the microbiome of the body. The oils will stain sheets. They'll stain clothing. And Lord knows sheets cost so much money, and you don't want oil stains on them. They'll also break down the latex of condoms. Animal-based substances should also be avoided, such as butter, egg whites, fish oil, and yogurt are some examples. Plant-based oils should also be avoided. You will see some websites that do talk in favor of using those. That is for a discussion with your doctor, a very experienced integrative health professional who understands if you are immune suppressed, if you are dealing with radiation, survivorship issues if you're dealing with issues after surgery and so on. There are a lot of things, but definitely involve a healthcare professional in that discussion as far as bringing in plant-based oils. Again, they can cause staining and they can cause breakdown of latex condoms, and they can cause disruption of the microbiome of the vagina, and should, if they're considered at all, should only be externally used of the vulva. I am not recommending that here. I am saying if you are insistent on something that is organic, have a discussion with your doctor. It is your body first and your health first, pleasant, intimate engagement that you're striving for, and not to make yourself ill again. So those are the things to avoid. And I recommend that when you shop for lubricants, that you shop online, because there are so many things to avoid. And I'd be standing in a store with my reading glasses on, peering at these boxes with this tiny print, going through box after box after box and getting frustrated, especially if there's a limited selection. Whereas if you go to a store that specializes, say, in adult, not entertainment, but toys and so on, or such as Amazon, or Walmart that has a large selection, you can really read through the ingredients and you can see and you can also read the reviews and see what people think of these types of lubricants. And take your time and also discuss them with your intimate partner and save your favorites, and then ultimately choose one or two. They are expensive, so you want to be careful in your choices. And that's better than someone staring at you in the store, wondering why you're picking up box after box and sliding your finger through all the ingredients. Of note, the vaginal pH is between 3.8 and 4.5. So preferable for vaginal penetration is a lubricant with a pH of about 4.5. There's not going to be a quiz after this, by the way. If you happen to be interested in anal penetration, the rectal pH is around 7.0. And so a lubricant with a pH of around 7 would be preferable for penetration for less irritation, because that is very sensitive tissue there. I will caution everyone to say that if you had radiation to the lower abdomen, to the pelvic area, to the prostate, to the gynecologic area, anywhere in that area, sensitive gynecologic, genital, rectal area, discuss that with your radiation oncologist, your doctor, before you do engage in intimacy. And also just be careful, use caution. If something hurts, stop. These are important discussions to have. And it is really in your best interest, if you have not yet been intimate, to just take things slowly and to take your time and to have a discussion with a provider that you trust initially, especially if this is your first time and you're foraying into this, to make sure that you're clear to go ahead and move forward with this. So in any case, if you have engaged in anal penetration before and you've noticed a little bit of stinging with your lubricant, you may now know why, if the pH was meant for vaginal penetration and instead it wasn't around 7.0. I was a little, I didn't know this until I started looking into this. So there you go. Let's go into types of lubricants there are. There's water-based lubricants. And the pros for those are they are widely available, they're inexpensive, they're easy to clean up, they're non-staining, they can be used with all sex toys, they're safe to use with condoms and dental dams, and they're FDA recommended. The cons of water-based lubricants is they may need to be reapplied often as they dry out quickly. If you are using a water-based lubricant and you do notice that it is drying out, please, please, please let your partner know that you need more. Don't be afraid to say something. And maybe you and your intimate partner should talk ahead of time and say, I'm going to let you know when I need more. And your partner should be more than willing to apply more, or you should be more than willing to use more. the other thing with water-based lubricants is they may also contain the most number of chemicals that can be irritable to the fragile tissue. They're safe with all sex toys, intimate toys, and they're safe to use with condoms and dental dams, and they're widely available and inexpensive and easy to clean up. Silicone lubricants. Pros: they do not dry out. They are less irritating than most water-based lubricants. They provide a lot of silky slip. They are also FDA recommended. They are safe for condoms, and they are safe for the body because they're not absorbed. Believe it or not, they're not absorbed. The cons with them is they are not recommended with sex toys that are made of silicone, and they can be harder to clean up since they're not water soluble, and they can stain sheets or clothing. Not like oil can, but they can cause some staining. So you may want to slip a towel under you or something like that, just to make you aware. So there are your pros and cons, and you may want to get both and see how they work for you. Also, there are thinner lubricants and there are thicker lubricants, and you need to see what works better for you in which situation. Remember to look at the pH depending on what activity you're planning on engaging in, and go from there. So no matter what lubricant is suitable for you, there is a good chance that using lubricant will enhance your enjoyment of your intimacy. Lubricant takes away dragging. It takes away friction. It decreases the risk for vaginal tears or anal tears. It can make penetration, masturbation, mutual masturbation, or rubbing of sensitive areas more pleasurable. So think about how lubricants might be able to be introduced as part of foreplay. So sexual scripts are how you normally approach your intimate encounters. It's really easy to stay on that same road because you're used to it. You're used to that path. It's a familiar path. Now that your body or your body image has been altered by your experience with cancer, your sexual script may need to change. And as your body changes through your survivorship in the aging process, your sexual script may need to change. But also, it doesn't hurt to just keep changing things up. Something that may be really positive for you and your partner to do: sit down ahead of time and think about different ways to introduce lubricant into your foreplay, or even into your conversations before foreplay, or to plan out how you might want to kind of have things unfold. Doesn't mean you need to stick to that script. Spontaneity is okay too. It kind of helps keep things from going off the tracks if you know what works. Also, if you find that something doesn't work, be honest about it. If something hurts or is uncomfortable, be honest about it. Communication is so important with this. If you find that you need more lubricant in a particular situation, or you need a certain touch to change, speak up. Speak up in a respectful, warm manner so that you avoid hurting that other person, because trust me, they're probably really trying to make this a pleasurable experience for both of you. And maybe even having a safe word ahead of time, a word you normally wouldn't use in this type of conversation. And the one that comes to mind for me is giraffe. I don't know why, but it does. Because when does giraffe come up in intimacy? But in any case, and that way they know to stop when you say that. You can talk about it, talk about what's happening. Intimacy can be intimidating after you've had a body image change, or body change, or tissue that has become fragile or narrowed, or you have erectile dysfunction. And there are so many ways to still enjoy intimacy and appreciate each other's touch and warmth and pleasure with one another in spite of the changes that have happened, and actually even improve things, because your trust is going to grow through this talking, and you're going to find out things about each other that maybe you didn't know beforehand, and have a lot more communication. Another thing to talk about introducing, and we talked about it briefly when we were talking about lubricants, are intimate toys. And they can be a wonderful way to enjoy conversation, to enjoy planning, to enjoy foreplay, to enjoy coming up with a new sexual script and changing things up. I would suggest that you kind of shop together and talk about things. They can be a bit pricey. Maybe talk with some friends or at your support group, ask. And I do intend to have a future podcast episode about intimate toys. Sexual script does go along with lubricants, and I think shopping together with lubricants and trying different lubricants. So I would suggest getting a smaller size to try out initially and make sure you like it. See if you like silicone or water better. But lubricant is really important to keep around. Explore and be brave in terms of trying things out that maybe you wouldn't have tried before and talking about them. Also, it's really healthy to fantasize and to think about things. If you don't want to share your fantasy, that's fine, but it's fine to fantasize while intimacy is occurring, because that helps you relax and it helps the pleasure to kind of occur with your body, and think about that. It's a good thing. I hope that you feel more comfortable shopping for lubricant. The information in this podcast is not intended to be used for medical advice. For any healthcare concerns you may have, please consult with your own healthcare team. The staff here at Everything Cancer Podcast will not be answering individual healthcare questions. Thank you. Take care. We hope you enjoyed this episode of the Everything Cancer Podcast.